I'm probably more surprised than you are almost to be standing here this afternoon, and this time yesterday I didn't think I was. I thought I was coming here to participate in a little panel discussion and enjoy the event. So suddenly I'm presenting on our experience in Northern Ireland, and I suppose I should start by saying that life and health sciences has always been an area of focus in Northern Ireland for the economy, but actually now most recently a link between our health and economy departments has an increasing focus on life and health science. And this has really been reflected in the creation of this presentation that I'm giving today. It's been pulled together in partnership between our Regional Development Agency, Invest Northern Ireland, and UK Department for Investment and Trade. And really the impetus behind this is that we have recently put in place a life sciences hub in Northern Ireland called Health Innovation Research Alliance Northern Ireland, which is a partnership between government, health, academia and industry, and with a focus on bringing new economic benefit to Northern Ireland. So this presentation was launched on the 12th of April, and so you may be among the first people to see Northern Ireland presented in this way. But it's a great opportunity for me to practice on you guys as a group. But this presentation will show you, I think, where we are on our personalised health journey in Northern Ireland. And I will say we have still got a long way to go, but we are positioning ourselves to take advantage of what we see as our key strengths at this time. So I just go here and here. So I guess, first of all, I should declare that we are interested in personalised health in its broadest sense, but this has focused on where we are currently strong in precision medicine, biomarkers and diagnostics in Northern Ireland, and we have a fairly fertile environment around this space because we have a couple of really strong diagnostics firms in Northern Ireland who have global reach and distribution networks. And also we have, in a previous era of focus on IT and brought together a number of companies and spun out a number of companies in the digital health space that have really made it possible for us to operate in this way. So showing our most developed area here at the moment, but as policymakers, we in the Public Health Agency and the Department of Health in Northern Ireland are keen to enable so much more. And all elements are now working together, our government, our academic and industry partners working together closely. And somehow that's the advantage of working at a regional level, because we all know each other. We can all get in a room and sit down, have a conversation, but we can at times then take advantage of our national facilities as well. So I should also, I guess, just mention the elephant in the room, the UK leaving the EU, as we call it. And at present, we're identifying our situation in Northern Ireland as an advantage because we are offering barrier-free access to Great Britain and EU markets and also the rest of the world. And on the flip side then, we have obviously lost to our Regional Development Agency the ERDF funding, so we're not sure what the outcome of that's going to be, and we're waiting to see just how that pans out. Nonetheless, we have, and I'm sorry for the amount of text on these slides, but I will put them on the Skook site so you can have a look at them in full, and also there's 35 of them, and I'm not going to do all those today. But we propose through our joint working that we have an ideal environment for partners to come and work in personalised medicine in Northern Ireland, and that we are in the position of developing, I should wear my glasses and I can see it down there. No, I can't. We're in the position of developing precision biomarker diagnostics and partner diagnostics, and also providing support for data analytics towards development of personalised medicine solutions. And key to this, I think it's on this slide, maybe it's not, I think it's on another one. Key to this will be our opportunities, investment that are coming from the UK government in terms of city deals. There's £150 million investment coming from central government. So all the work that we have done to put in place these building blocks, hopefully that will boost us to the next level. And I suppose what I wanted to mention on this slide is the fact that, you know, we have two very research active universities, both of which are focusing on personalised health in slightly different ways. We're also building skills within our workforce in personalised health and medicine. We have offered in Ulster University the first stratified medicine master's courses in the UK. And we also have then our companies in diagnostics and digital health. And I guess this is being pitched as a business opportunity, so we're emphasising how competitive we are as a region to develop personalised medicine solutions. So coming on to the next slide, I suppose this slide aims just to show you the different steps along the way of developing personalised medicine. It mentions the city and growth deals, but it shows you the different steps that we have in place and the different infrastructure that we have in place. So not only can we help develop the diagnostics in a research environment, but we can also have links into the clinical environment to help validate and trial any new personalised health approaches. And also obviously have the support from our Regional Development Authority, which hopefully will still be available to help commercialise those successful tests. And just to point out here, the Hirani reference, this is our new Life and Health Sciences hub that is working to be a portal into Northern Ireland and is working with all the different partners within the ecosystem to bring investment opportunities into Northern Ireland. So just to go down into the details slightly more, we have these three companies that we wanted to mention in terms of the global players in diagnostics. Almac Group, a stratified medicine company specialising in biomarker-driven clinical trials, and Randox, where I used to work for a few years, which is also a long-running diagnostics company that has branched out into the personalised medicine space with its biotechnology. And then Proaxis, this is a company set up by my PhD supervisor, and it's now a spin-out from Queen's University and has focused on protease, point-of-care protease diagnostic assays. And over here on the right-hand side, you'll see where we have invested a significant proportion of our research funding. So in the Ulster University, we've invested in the Northern Ireland Centre for Stratified Medicine, and that was our first investment and our first foray into funding research in this sort of personalised medicine space. So that centre has very closely linked the University of Ulster with the Altnagelvin Western Trust Hospital, and the clinical researchers and the biomedical science researchers work there together very successfully. And based on the back of this investment, we were then able to secure some infrastructure funding through Interreg to support a centre for personalised medicine and clinical decision making that has just finished its run of 4 years, and hopefully we'll be able to target that into future funding. That centre has set up a biobank of patient samples that it's able now to use to look at what hopefully will be a focus on long-term conditions going forward. And then Queen's University, we also have funding which is linked to the UK catalysts, and in there they have a focus on cancer. So whilst we have separate centres, they do complement each other in their areas of focus. And within, I suppose it's important to say that within the Cancer Precision Medicine Centre, we have also funded some specific staff who are focused on creating the opportunity for adoption of those personalised medicine diagnostics into practice, because often it's the same people who are the clinical researchers who are there then treating patients in the clinics, and they are able to hopefully influence their colleagues towards the adoption of these personalised tests. What else do I want? I didn't want to cover that one. Yeah, so then I'm moving on to data, and we've heard, you know, how important data and digital is in the personalised medicine landscape. And I suppose I just wanted to kind of cover some of the stuff that's happening in the public sector in our region, and also the companies that have either invested or been spun out from the digital sector in Northern Ireland. And as I said, there was quite a focus on the digital sector for some years in our regional development, and we have been able to attract quite a lot of investment and create quite a lot of jobs in this space. So we're well positioned to pick up any opportunities around personalised health. So, and because we have then our National Health Service, which we refer to as the HSC, the Health and Social Care, we do already have our electronic care record that covers our population. What I would say is that it's not entirely joined up in the way that we would like it to be. We do have good access into the secondary sector, good access in primary care and social care, but they're not joined up enough for us to really take advantage of them, and that's where we're focusing our attention at the moment. We have also, as has been mentioned, we're building trust with the public. We have investment from what's called Health Data Research UK, people may know of, and that has allowed us to put in place in the Northern Ireland Trusted Research Environment, which is one of its work streams has set up a public data panel along with Belfast City Council, so to create the opportunity to discuss with citizens how the use of data in this space would be of benefit. I mean, COVID has created an imperative around this, which has helped things to move forward. And we have, you know, quite strong digital support now within health and social care that's allowing this particular agenda to move at long last. I would say, I suppose it's been quite a difficult journey, but certainly I'm optimistic that will help us now to create a very much more collegial environment around the data piece. So then to move on, in terms of skills, I suppose I've really probably covered for the most part the fact that we have these the courses that are focusing around StratMed, but I think also to highlight the fact that because of our small size, we've been able to bring our industry partners in to invest in training opportunities in the universities, and we're also looking at fellowships to increase to help increase digital literacy across the clinical and healthcare workforce. So we do have a couple of world-leading universities in Northern Ireland, and when we can stop them competing with each other, they do quite a good job if they collaborate together. And again, I think that's one of the key things that we are trying to ensure is happening in this personalised medicine space, that all our universities are working together. And you will see, well, possibly if you look at these slides in detail, you can see where they're beginning to work together. And I think around the city deals, that the investment that's coming from central government, that has been a real catalyst for our universities to realise, hey, wait a minute, we've got to make this work. And they are actually sitting down together with each other. Let me see now, I just want to jump to the next one. So this slide does show you again some of the areas, and I've mentioned a couple of them, but there's lots more that we've invested in that will kind of fit around this personalised medicine space. And certainly we feel that we're very well covered in the research space, and we are getting there with the data space. I suppose the next step for us is how do we ensure that our citizens are benefiting from all of these opportunities that are available, and that public dialogue hopefully will get us to a point where they understand and realise the opportunities that are open to them. So this is just a cheeky little slide here which sort of highlights Northern Ireland's current position in the whole EU landscape, and as I said, we're seeing it as an opportunity. And I suppose I just wanted to say to everyone that we in Northern Ireland are still keen to be partnering in personalised health and other areas. We have in place a strong clinical research infrastructure, I think this is the right slide, to support research in health and social care environment. So our investment has long-term been in bringing skilled research professionals into our workforce and creating the supporting infrastructure where clinical trials and research can take place. But we also, as a funder in the Public Health Agency, as a funder of research, we then place some studies along on top of that research infrastructure support, and some of those in personalised medicine and some of those in the data analytics and digital space. So I think we're coming close to the end of what I wanted to highlight. I suppose this slide, no, the next slide, is to highlight the partnership working. And I have to again acknowledge our regional development agency who's brought together this presentation, and our colleagues in our new life sciences hub. And this is us here, HSC Research and Development. So our website is there if anyone is interested to see the work that we're involved in. And I guess the last thing I wanted to just say, I'm sure I'll get there at some point, is yes, our commitment to investing in the future. And this one highlights the city deals, but I wanted to add to that we have been active already for a long time, an active record of partnering in Europe. And we were partners in the European Innovation Partnership and Active and Healthy Ageing. Through our expertise in medicines management and optimisation. We were leading the 4-star network in EIP AHA for a while, and that was a great opportunity for us to share and learn good practice. But it's also an important dimension of the personalised medicine and personalised health. We're looking at ongoing investment in personalised medicine and health, exploring all Ireland centres in personalised medicines with our colleagues in the Science Foundation Ireland and Health Research Board, working together with them on future Peace Plus interregional funds that are still in place for us in Ireland, which is really exciting, and we're hoping to continue a lot of our work through that vehicle. We're not sure what's going to happen about Horizon Europe. Although for us it's not a deal breaker, we'll still work with people because essentially we're open to discussion. The issues are still the same, they don't change because the funding environment has changed. So we're keen to reach out and partner in the personalised medicine space. I think we've got a lot more to achieve still, and SAPHIRE has been a really great consortium for us to be a member of. And I know you're going to hear about the roadmap that has come out of the SAPHIRE project. And all I can say to you at this point is, I wish that we'd had that 5 or 10 years ago. I feel that we've partly arrived where we are now with the minimum of planning. And I think that it's also a really good opportunity to use that roadmap to say, here's where we are now. where should we go next? I think that's probably everything that I wanted to say, and hopefully you get a flavour of what we are doing in Northern Ireland. Please have a look at the Skooks website. We're also in the pitch tomorrow, I think it's tomorrow, so you can get a little bit more information about us there as well. And happy to take any questions.
A very short one. Thank you for your presentation. In terms of diseases, is it focused on cancer only, or I was about to say only, or is it about different?
Yeah, so probably if you were to ask us what our strengths are in, that we would say cancer, respiratory, vision, and we're looking to develop our strength now in long-term conditions. So those would be our main areas of focus.
Thank you. So, for the sharing of data, how do the people in Northern Ireland look at it? Are they keen and open to share their data, or they're standing on the privacy issue? How's the feeling on that?
Yeah, well, I think that's where we really are having to work and focus, because I think people think their data is being shared, but they're probably not really sure, they're probably not aware of how little flexibility there is. We have an honest broker service, which is able to use data in an anonymised form, but we have not got the legislation in place yet that will allow us the flexibility to use identifiable data. So I think for me, I would say that a lot of people believe their data is used a lot more than it is. And I think we just have to have those conversations to find out how they feel about it being used and for the betterment of their health.
It seems you have a very strong collaboration between academia and industry in this area. Can you say some more about how you do that, the programs you are using and so on?
I suppose the most detail around that is, so let's start with ourselves in health and social care research. We've put an industry engagement unit in place within health and social care, and our aim of doing so is to make a clear pathway for industry to find their way to the right place for collaboration. We work pretty closely with InvestNI at all times in terms of they have funding streams to help industry to partner within academia and health. But our universities, particularly keen to spin out companies or to provide incubator space for companies, and one of a couple of incubator places as well within the hospitals that are allowing companies to sit in health and work. So we've still lots to do, but I think the opportunity to create this life sciences hub now has come about from the recognition that it's really important and none of us can do this by ourselves and we really need to work together.
Anybody else? No? That's it. Okay.
Thank you.